All right, everybody. Welcome. Thanks for joining us on InStride Live this week. We're going to get started. Tonight is a presentation with April, Melinda, and Shelli, talking about insurance issues and making sure information is correct from the get-go to make everything smoother from there on out. I appreciate them putting this together and thank them very much. April, I'm going to go ahead and pass the presenter role to you, and I will ask everybody else to mute. And imagine if there is a question and answer, we will either do that at the end or at a time that April or Melinda or Shelli want to take questions. And I appreciate their help. All right, April, thank you.
Thank you for joining this afternoon. For the ones that could join, we're hoping that this can give some insight on some of the stuff that the centralized billing department is seeing, and try to help out our front office staff, or whoever is putting in your insurance information, checking in the patient, that sort of thing, because we are seeing so much and it's delaying your money. And when it delays your money, it also delays our billers because it puts them in having to correct a lot of things. Now, we want them as the second eye to what you're doing, but when it becomes consistent and repetitive, then that's time for us to speak up and say, "Hey, let's help y'all out. Let's, you know, kind of show you what we're seeing so that it educates your office, it educates you, but it helps everybody out in the long run." So we're going to go over some of those errors and issues this afternoon. In the presentation, you are going to see several slides on the issues. However, after the PowerPoint, we are going to give control over to Shelli. Shelli is going to guide us through some of these examples and show your staff or you how this information is supposed to be entered in ECW. Now, you may be on here and you might be on CareCloud. That is fine. The same rules are still going to apply with what is needed. But if you need more information on, how to enter that information into CareCloud, then we can do a one-on-one and get you acclimated with that. So please, please, if we use examples from your practice, I promise you we're not picking on you. We are not trying to upset you because everybody is doing it. It's not just one practice, okay? But we had to find examples in order to show you, the kind of things that we're seeing and how we can fix it. All right, so we're going to start out with our insurance eligibility issues, and we have several examples on this topic. All right, so here in example one, I think this is a pretty neat feature in ECW because I'm pretty sure we don't have this in CareCloud, but I'm ready to look to see if we do. But this is actually a premium notification. So in ECW, when an eligibility report is processed, if they have, one of the marketplace plans like Blue Cross Blue Shield and Bright Health, it will actually tell you down at the bottom, you'll see where my blue arrow is. It'll actually tell you how far the premiums have been paid. So if the patient is coming in June or July and you ran this and you said, oh, their premiums have only been paid till May 31st, that might propose an issue in you getting paid in a timely manner. Now, not to say they won't go and pay their premiums and then the claims get processed, but you need to know this because then this way you can handle the patient a little bit differently. You're not dispensing all these DME items and things like that you might not get paid on. But also, you can tell the patient, hey, I'm showing that your premiums have only been paid up to the end of May. So today we'll have to treat you like a self-pay patient until we see that your insurance premiums have been paid, or we can reschedule you until you can get the premium situated to where it does show that you are, up to date with your premiums. So little things like that can help so much, but we have to teach our office staff the things to look for. So this is an example of a premium notification and can be very handy when it comes to those marketplace plans. So here in example number 2, we have a Medicare Advantage plan. Now, if the patient comes in with a red, white, Blue Medicare card, even though you still run the eligibility on that information, it's going to show that it's active. But that doesn't mean that they don't have a Medicare Advantage plan. So it's very important that if a patient presents with a Medicare red, white, and blue card, that you are opening up the eligibility report to see if they have a Medicare Advantage plan. Probably half and half, 5 out of 10 times, they are going to have it. So when you open up that eligibility report in ECW, you can read in there and it will give you that information. So I have that highlighted in yellow. So here it'll tell you the patient has a Health Maintenance Organization HMO Medicare risk policy. And if you look on down, it'll say primary payer name, Liberty Advantage. Liberty Advantage is a Medicare Advantage plan. Okay, so that should be put in the system instead of the Medicare red, white, and blue traditional card. Okay, because we do not need that information in the system. Now you can make a copy of it and put it on the patient's chart, and that's fine if we would ever have to resort back to that, because that does happen. If a patient has, for example, if they are hospice, we cannot build a Medicare Advantage plan for hospice care. We have to resort back to the traditional Medicare plan. So it's always important to have a copy of it in the insurance profile. So again, when you run that eligibility report for a Medicare patient, you need to open it up, you need to read it, look under the coverage info, and make sure there is not a Medicare Advantage plan. Here in example, I'll go back real quick in case Melinda wants to say anything additional on this, because this was her slide. So Melinda, do you have anything additional you want to say?
Yeah, it's just important that you run it, that you view it. You go to the medical care general, as April said, you see that they have a plan code C. That should prompt you to ask the patient for additional insurance information.
Yep.
This will help reduce the denials that we receive on our end. Also, will also keep the money flowing quicker.
Example number 3, we have an MSP type. Now, this has to do with your Medicare secondary payer, and we have to make sure that we are putting in what type of Medicare secondary payer type it is. And I'll tell you why in just a moment. But here is an example out of ECW. Here's an eligibility report that was ran. If you look over to the left, it does tell you it is a coordination of benefits, and there's another payer. Payer number 1 is Aetna. Okay, so that way we know Aetna is the primary payer. So now we look over to our left and we see Medicare secondary working age beneficiary or spouse with employer group health plan. That is your Medicare payer type. That verbiage right there. Secondary working aged beneficiary. Now, those payer types are coded by 2-digit numbers, and of course, in ECW, it does not give you the numbers, but when you go to put the information in the correct spot, it does give you the numbers. And we're going to show you that here shortly. But it's very important that when you have a Medicare secondary payer that you have to put in this plan type. The reason being, and this goes for CareCloud as well, the reason being is if you don't put it in, when you try to send Medicare electronically, it will not pick up the primary information to send. Okay, and so that results back in denials, saying that they never received the primary EOB. So we have to make sure that we are putting in that information. And I think it might cause some type of rejection as well, but Shelli can get more into that when she shows you some examples. But very, very important that you always put in your Medicaid secondary payer type.
So the example number 4 is Medicare versus rural Medicare. So this is results in a denial as well. So if you see there on the right, we have an example of what the card looks like. And let me say, I apologize. And then when you look it up into ECW, you need to make sure that you pick the correct payer address. So it's Medicare Railroad, Palmetto in ECW. Uh, so it's just important that you run eligibility, you review eligibility, and you also view the card, and there's a sample of the card and what the railroad retirement card looks like, and that we choose the proper address when we set up the insurance profile for the patient.
Our next example is Blue Cross Blue Shield ID errors. These are huge. These are really huge, y'all. There's such easy fixes that can be done by our billers, yes, but there's so many that has to be corrected that it slows the billers down. So we really need for our front office staff, or again, whoever is entering the insurance information, to pay really close attention here. It is very important that you put in the complete member ID number when it comes to Blue Cross Blue Shield. There is a prefix and a suffix for the majority of the Blue Cross ID numbers. Now, we're not referring to, to federal, because that begins with an R, but we're talking about all the other plans that begin with like YPYW, YPYJ, those type of prefixes. What's happening is a couple of things. The full member ID is not being put in to where the suffixes are being listed on the end of the member ID, the corresponding suffix to the payer, or they're running the eligibility report, and of course it's going to check that it's active, because maybe the patient does have a Blue Cross plan, but you're using an old member ID number, but when you run the eligibility, it picks up the correct member ID number. And that's giving you the correct member ID number to replace in your insurance profile, and that's not being done. So they give you the information all on the eligibility report. So I know there's some black scribble here, but I want you to look at the second blue arrow. You can kind of see where it says prior identification number, and it ends in a 7. So when this eligibility was run, it was pulling off of what was put into the system. Okay, but if you look up at the first blue arrow, the member identification number ends in 00. Well, 00 is the suffix. So that 00 should be followed after that 7. That should be 700. So a lot of that is not being done. It's not being corrected, and it's causing a lot of rejections. Again, they are simple fixes, and our billers don't mind fixing them. But when there's hundreds and hundreds, that becomes a lot, and it takes up a lot of time. So it's very important that your staff understands how to enter member ID numbers off of really any insurance, not just Blue Cross Blue Shield. It's all payers, but they really need to make sure that they understand how to enter that information in. Next thing that's really big with the payers, especially Blue Cross, is the patient's name. If the patient's name does not match in your system to what is on that insurance card, it will reject. So if you have a patient by the name of, I'm going to make one up here, Gregory A. Smith, and patient likes to go by Greg, and they just put in the system Greg Smith, Blue Cross is going to deny that because that's a nickname. They want what matches on the actual insurance card. So it should say Gregory A. Smith. Same thing goes with if you're a junior, a senior, if you're a third, a second, a fourth, whatever, all those that are out there, it has to match. So use the nicknames in the other sections that the system gives you for, like, it might say nickname, it might say other name. I don't know what all the software says, but use the first name and the last name for what is on the insurance card.
All right, so example number 6. So as we know, we have Humana Commercial and Humana Medicare, right? So we see a lot of Humana Commercial being chose when they actually have Humana Medicare, Advantage. So something this little impacts us greatly. It affects the way the claim is being billed. It affects the way the provider can, treat the patient as well. It also affects the way the claim splits in ECW because Humana Medicare requires for all DME to be placed as Service 12. So when we pick commercial, it does not, the claim does not split, and it can potentially cause billing errors. We are we are fixing this on our end, but once again, that's one other thing that takes time that we need the offices to be watching and paying closer attention to, not just pick the first Humana that they see when they're searching, that they pick Humana Medicare when it's truly a Medicare patient, Humana Medicare patient.
All right. Example number 7, Medicaid. This is another huge issue that we have. So CareCloud is going to be a little bit different because CareCloud does not, when it runs the eligibility reports, it does not give you the information to know what managed Medicaid plan they're on. And you have to go out to InStride and you have to look that up. But in ECW, it does. So here is an example of an eligibility report. And you can see over in the yellow that it says there's a health maintenance organization coverage. And if you look down, it also says that the managed care organization is Carolina Complete Health. Okay, so it does tell you who the Medicaid plan is. You can't just put in Medicaid and expect it to just go to the managed Medicaid plan. That's not how it works. So that information does have to be checked each time the patient comes in, because as we know, if you provide service to Medicaid patients, that Medicaid plan can term within that year. It's no longer good, year to year. I mean, it could only be active for 2 months or 3 months. So we have to be very, you know, proactive in checking the Medicaid and making sure that it's still active and what plan they are under. Melinda, you have anything to go with this?
I was just going to say, when they add the Medicaid, please term it, make sure they, if they didn't update, that they term the Medicaid so it doesn't look like they have a secondary.
Okay. So now we're going to go into some ECW requirements for patient demographics. This slide here, I actually emailed out to everybody several weeks ago just to try to help, our ECW people to get a little more information on what is required when they are filling in the patient demographics. What are some things that are affecting, us on the billing side because it's not filled out, or it's been, maybe it's just been left. So we're going to go through these real quick, and you'll see some of this also as Shelli does her tutorial on that. But we want to make sure that you choose the Y, which means yes, in the box that is for release of info. And that's after the patient signs a HIPAA and financial release. Okay, so you need to put in that Y, and we can show you where to put that in. But that is it's going to have to be done, on the check-in person's side, or whoever, check out. As long as it gets done before the billing gets to us, it's going to have to be somebody. Just a reminder that all Blue Cross Blue Shield should go to your local Blue Cross, and that includes out of state, primary and secondary. Now, Shelli is going to show y'all here shortly there are several Blue Crosses to pick from based off of your prefixes. And then, of course, we can talk about the federal and the state if we need to. But just remember that out-of-state Blue Cross has to go to the local Blue Cross. And that is so that it processes in-network. If you don't send it through the local, it's not going to process in-network. It'll be out-of-network. And it's either going to process as out-of-network benefits, or it's going to process as a zero pay because maybe they don't have out-of-network benefits. The next thing is, if you cannot locate a payer in the system, please email Melinda and she'll make sure that she gets the payer loaded into ECW and all that good stuff. Just because there are some things on the back end that has to be checked off in order to make sure that payer works the right way. And I'm sorry, y'all, if y'all hear my dogs in the background. Um, Also, please scan in a copy of the insurance card. They need front and back, and it needs to be legible. Okay, it can't be cut off. It needs to be a full scan copy of the insurance card front and back. It's very important because the billers will have to go back and, if they're trying to find a denial or they're trying, whatever it might be, they have to resort back to the copy of that card. Sometimes the answer is on the card. So please make sure that your staff is getting an updated copy of the card front and back.
It's
Um,
right. It's scan it in, and I don't know if they can view it because a lot of times they're upside down, they're sideways, they're every which way, and it's hard for us to go in and to do what we need to do when we're trying to view a card because a lot of times the answers are on the card for us, and it's very important that there's one in the system.
yeah. And I'm not for sure, Melinda, you can answer this, but I think when you scan in the card, it doesn't let you turn it. So when they're sideways, or upside down, it's really hard for the billers to be turning their head or trying to stand on top of their head to read the insurance card. So yes, as she is saying, if you can view what you scan in, that would be great. Because we do want to make sure that it's in the upright position and it's very easily to read by everybody. The next thing is make sure that your staff is reading the back of the insurance card to obtain the correct mailing address. Many payers, like I have listed here, they have different addresses to send claims to, especially some of these payers that might use, like a third party payer. So you might get an insurance card from somewhere and it might have 3 different payers listed on it, but it specifically states all medical claims go here, all dental claims go here, all out of network claims go here. So it's very important that they understand how to read the back of an insurance card and know where to send the claims to. Um, because that is a big issue when we do see like a med cost that may have to go to Health Team Advantage or somewhere, other than that. I mean, but it states on the back of the card where to send the claims to.
So April, I was just going to piggyback off of that and say, like med costs, we just need to make sure too that they're adding the group number. That's very important because they will deny without the group number.
Yeah, I have that down at the bottom.
Oh, you do? I didn't even.
It's okay. It's always good to give reminders. Hey, we'll say it as many times as we need to. All
Yes.
right. All right,
I'll make a
y'all.
little tears down there.
It's okay. It's okay. All right. Again, just remember, have your staff to review that eligibility. It's very important. A lot of the information can be found on that eligibility report that could help so much. Managed Medicaid, again, needs to be put in as managed Medicaid and not North Carolina Medicaid. Now, we just mentioned that, on the last slide. So they need to make sure that they are entering in the managed Medicaid plan. And then also, whenever they're picking the correct plan type for the insurance companies, and we're talking now more of commercial and Medicare Advantage, they need to, it says it in the eligibility. If it's an HMO, it's going to say it's an HMO. If it's a PPO, it's going to state that it's a PPO. But what we're finding is that they're just picking something random. They're not really looking at the eligibility to determine what type of plan it is. So I have some common abbreviations here and what they mean. The plan type just has to be put in correctly because it affects the way the claim goes out. Also, all of this together affects how a provider treats a patient. Okay, so a provider might be giving out DME or orthotics, and okay, so again, let's go back. It's very important to make sure that you're picking the correct information when it comes to plan types because it does affect how a provider treats a patient. It can determine how he wants to bill for that item. So it's just very important, that you're putting in the correct information. All right, on the Medicare secondary, as we spoke about earlier, you want to pick the correct plan type. Now, this is an example of where you would put in the plan type and you can see how it's numbered. So what I was talking about earlier, how they have corresponding numbers, once you do this so long, or if you just want to make a cheat sheet, you can, but the definition is there. So you see Medicare secondary working, and if you hover over it, it's going to tell you the full definition. So whatever the definition is in the eligibility report, that's the definition that you're going to pick here. Okay, and we'll show you an example here shortly. And just a reminder, we need to enter group numbers, as Melinda mentioned just a second ago. We need to enter group numbers when you enter member ID numbers, especially for MedCost. MedCost will reject if we don't have the group numbers listed in there. So make sure that you're putting in your group numbers. But for Medicare, there is no group number. You do not need to list the word none. You just leave it blank. There used to be a time that we had to put in none for the group number, but that's no longer. It will reject. So make sure that you are just leaving your group number blank for Medicare.
All right, so this is some of the examples of the Blue Cross Blue Shield prefixes and with the corresponding payer profile. So, you know, April, I know you said we should all send it to the local, but we have a few exceptions to
Yes.
the Blue Cross, which is, you know, the first one, the GJN, that is Healthy Blue. That will go to Healthy Blue when you set up your patient insurance profile. The Blue Cross Blue Shield, there's a state of North Carolina, the YPYs. You can also choose that in your insurance profile. And the same with the Blue Cross Blue Shield Medicare Advantage plans. That will go to the Blue Cross Blue Shield Medicare Advantage plans that are in ECW. And you see the different, and then the Blue Cross Blue Shield the supplement, the YPZ, that will still just go to the PO Box 35. So that's just some examples with some exceptions of the Blue Cross Blue Shield. And also, we could talk about the United Healthcare Managed Medicaid. That we only need to select, we need not to be using the United Healthcare Community Care Plan, even though it is on the card. It is set up as ECW, as United Healthcare Managed Medicaid. That's the one that we need to be choosing in ECW. Then, as April had mentioned, Medicare, Champ VA, Blue Cross requires the name to exactly match, you know, what is on, it needs to match what is on the card. If the patient has a nickname, there's places in CareCloud, I believe, and in ECW that you can put that nickname or the name that they choose to be called. You can add that in that field. But if you put it in as in the profile, the insurance will deny. It will not get paid. In ECW, it's called preferred name. You can put it in the preferred name. And then it's important that we pick the correct insurance profile. As April said, I can't tell you how many Advantage plans that people add in the system that they have United Healthcare Medicare, they have Aetna Medicare, and they're just picking any United Healthcare, they're picking any Aetna. It's important that we choose the correct plan. This drives how we bill, and it drives where important to where the goes for the insurance company for payment. We are watching for that. We are correcting that. But really, we need to make sure that the offices are paying attention to that and choose the correct insurance profile.
Okay.
Thank you. All right. So also when you're changing the payers, we need to make sure that if it's truly a payer that needs to be terminated, that we are terminating the payer, choosing the date and that we're clicking terminate, because if you leave it in there, the system might recognize it as a secondary, and it sits there and it's, aging where, truly may be a patient responsibility, but the system thinks it has a secondary. It's sitting there. The patient gets a statement, 2 months down the road, 3 months down the road, and, wondering why it's taking so long. Well, we need to make sure that we term the policy when it's no longer active. Um, we also need to make sure that if the patient comes in and presents, they say they have an old Blue Cross Blue Shield policy, but they got a new, 2021 they had, YPY, but 2022 is YPW. We need to keep the YPY in there, term it for 2021, and add the new insurance for 2022, because we've not gotten paid for all of 2021, and then we don't have access to the insurance because it has been overridden by the new policy. Um, and that's it for that.
Okay, perfect. All right, so that is all we have for the slides of examples that we were going to go through. What we would like to do now is take these examples and have Shelli to demonstrate these examples and how to fix them, where to put the information in at. Again, we are using live examples, so again, it's not toward anyone on the call. It's just we had to provide examples because everybody's doing it.
Okay, so I don't actually have examples that are things that someone has done wrong. These may have been correct. It's more examples of eligibility checks that have been run and examples of what you're going to see when you run that eligibility check. And then I'll also show you things like where to go to add in an alternate name if the patient has a different legal name than what's on their, say, Blue Cross and Blue Shield card. So, but for this patient, this is one that has a premium paid through notice because they have Bright Health. And I know you guys go from a different direction than we do here in billing. So everything that I have is going to jump from a claim. Um, but when you guys are running your eligibility checks and then you're going back to look at a check that's already been done, you're probably going to go through the hub and you'll click on billing logs, and then you'll just go to the last one that was checked under accounts. You'll click on log detail and then report. And then here is the premium paid to notice. Okay. Of course, the other information is good too to make sure that the names match, things like that. But for this one, that's the big thing. All right. So for this patient, this one's going to be a Medicare eligibility check. All right. So with Medicare, we always click on coverage info and then switch down to medical care general. And it's going to give you all of the information over here. So on just a regular Medicare patient that has no other insurance as secondary, or primary, has no Medicare Advantage plan, it's going to stop about right here. And the things that you're wanting to look at and pay attention to are the Part B coverage. And then over here, you want to make sure that that coverage is active and that around in here it doesn't say railroad. So when you're doing just a routine Medicare eligibility check, that's what you're looking for. So for this one, this patient has a Medicare Advantage plan. And if we scroll down, it'll show you who that plan is through. And then this will also show you that it's Medicare Advantage, which is your Part C plan. And then usually, well, no, sorry. All right. I'm going into the billing log to look at the eligibility check in a different way, but like I said, you would go to the hub billing logs. Okay. All right. So for this Medicare eligibility check, and again, you're going to click on coverage info, medical care, general. For this one, it has the Medicare secondary information. So Medicare is secondary to this payer. Okay. So for this one, I'm just going into the demographics page, just where you would normally enter insurance information. And to update the Medicare secondary payer, you're going to click on your Medicare plan, click update, and then you're going to click on additional information over here. And then down here at the bottom is where that's going to be. Okay. And this one's already been changed.
So Shelli, click on the dot, dot, dot to show that it brings up the list that April had on the previous slide. Yeah.
It does. And the two that we use most commonly is 12 and then 43.
43.
12,
Yeah.
and for the most part, 12 is going to be your patients that are 65 and older, and then 43 is going to be anybody that's younger than 65. Not always. You should definitely go by the eligibility check, but as a general rule, that's what you're going to find. That's the only one that I had that has the Medicare secondary to an actual primary payer. Is that what you were talking about, though?
Well, sometimes it says secondary to liability insurance.
That's what this one
And
is. Okay.
okay, yeah.
That's this one. All right. So for this one, what she's talking about is this one's showing no fault insurance. You'll also see some that say workers' comp, things like that. So with those, it doesn't actually mean that there is a true primary payer. In this one, it's probably from an auto accident that the patient had. And those are usually geared toward a diagnosis code. So Medicare actually assigns this MSP code to specific diagnosis codes that would be related to what happened or what injuries they received during that accident. So when we see things like this, we just kind of look for, we try not to use pain codes or injury codes, things like that. Instead, use something else if there's any other codes on the claim rather than using those type of codes, because they will trigger a denial because they're looking for an EOB from this payer before they'll pay those codes. But other than that, even if we get those, they're a little aggravating to clear up because your patient is, basically has to call in and discuss it with Medicare to let them know that it's not related to whatever the accident was. A lot of times these accidents are in here from years ago and they just never cleared them out of their system. So it's just a matter of them clearing that up. But it takes hours for the patient sometimes. So a lot of times it just doesn't happen. The next one I have is a railroad Medicare. All right, so it looks just like a normal Medicare eligibility check. The only difference is this right here. And it just shows you that it's railroad. And for this patient, Medicare Railroad Palmetto is what was selected. So Medicare Railroad Palmetto GBA. And that's because this is a North Carolina patient. South Carolina is different, but this is the North Carolina payer profile that you would select. All right, so this one is Cross and Blue Shield, and it's just an example of where when the eligibility check was run, and I don't know how far back I have to go. All right, so when the eligibility check was run, this was the ID number that was entered into the system. And then this was the correct ID number. So Blue Cross and Blue Shield, like they said before, it's really cool actually with the way they give responses, because they will tell you if you've entered it incorrectly. It'll also give you the correct ID number if you've just entered a typo. So if you just literally miss a number, or if you type the numbers backwards, not the whole thing, but a couple of numbers within the ID, it will usually give you the correct ID number. If everything else is close, it'll give you the correct ID number. And all you have to do to fix it once you've run your eligibility check is just click on the ID number, or double click, sorry, and then just Control C to copy it, and then go back to your profile and paste it in. So it's really easy just to click update and paste it in. So it is pretty quick to fix those. But it is nice that that the ID number is there for you. And so each of the patients that are on the family's plan has a different suffix. So these 2 digits are going to change based on who your patient is, whether it's the subscriber or a child or the spouse, that sort of thing. And these 2 digits tells Blue Cross which one it is. And they will actually not reject the claims, but they will deny them if these are not there. So sometimes it rejects, sometimes they deny. So time-wise, it's really important to go ahead and get this corrected before the claim ever goes out.
So I always take it a next step, and I always rerun eligibility after I update it, because I want to make sure that it's prior, that it's clean, right? So
Yeah.
I always, and I believe Beth has, if you look, it should be rerun. If you go back in the billing logs and you look at the last eligibility, and then
Nope, this one also.
did she not? Okay, did she not pull it in? That's another thing. If that's
Yeah,
why I
so
always
after
that's why I always double check after I do a number.
yeah. So from the billing standpoint, we have to go a little bit further than what you guys do, because when you make a correction in the demographics page, so when you make the correction here on your insurance information, it doesn't automatically update on the claim. And the reason for that is, insurances change. So, this patient may have a new ID number next month, and you don't want this claim to change just because the ID number has now updated. So, to get this to change here, we actually have to pull that information into the claim. So, basically, and I'm not sure if it was this one. Let's see, 725 is the date of service, and this one was run 726. So this is just the first one that she ran when she was working this claim initially, and she corrected it. Um, but anyway, so we do have to pull it in. So there is an extra step once we do correct the ID number, or once you guys correct the ID number, whichever happens. All right, so this one is Humana Commercial. And this one isn't even a claim that's going out. This is just non-covered routine foot care. But it is an example of, so you've got Humana Commercial as the payer, but your patient's 96 years old. More than likely, this is not Humana Commercial. Okay. So if you go in, same thing, you usually go into coverage and medical care on most of them. If what you're looking for you don't find under medical care, then you start looking elsewhere. But for the most part, that's where you go to find anything. So on this one, there's a couple of places. So it shows it here, Medicare PPO, and then also over here. And with the different plans, so in other words, like Cigna, Aetna, things like that, all of the different plans, you'll see this in different places in the information that they send back. Another place with the Humana is here. So this is your Medicare ID number. So that's also good for, if you need the Medicare information for, say, your hospice patients and things like that. So it is good to have it. All right. So with the Humana, Humana is one of the payers that when your patients' accounts are migrated over from your old billing system into ECW, they will all come over as Humana Commercial. No matter how you have them entered in your old billing system, they will all come over as commercial. So all of them will need to be updated. And I'd say 80% of our Humana patients are Medicare patients rather than commercial. So there's a lot of them that do need to be changed. Even ones, I don't even look at the ages anymore. I just automatically pull the eligibility check if I see a Humana commercial, because even ones that are less than 65, I find they have Medicare a lot of times, or Humana Medicare. So a lot of those have to be changed. All right.
I would say 95%.
Yeah, it's really high, really high. So all right, this one is an example of a Medicaid eligibility check. Okay, so this payer that the eligibility check was run on is Medicaid, okay? But it's going to show you that the patient, and actually, even before I click on the medical care, it's already showing you that this patient has a managed Medicaid plan and that it's through Blue Cross. So this patient has Healthy Blue rather than Medicaid. But you're not always going to see it because honestly, it doesn't always show it. But most of the time, it will show it if the patient has managed Medicaid. It also shows you your plan code here. The eligibility check for all Medicaid will show you a plan code. The plan codes will tell you if the patient has, say, family planning, which means they don't have coverage at all for anything that we would treat them for. It also, if there is no code listed, more than likely it means that they have a plan that only covers their Medicare Part B premium. And so, again, they don't have any medical coverage. And so, most of the time, it will show up as eligible. But when you look at the actual check, it won't have a plan code listed. So that's just kind of a tip to search further. Go on NC Tracks and actually look at what it shows there, things like that. All right, so that was all of my actual examples of the different eligibility checks and things that you would see. So I'm going to show you, let's see. All right, so just up here first. So I'm going to look at the preferred names and the alternate names, things like that. So you want your patient's name that you actually enter on the account to be their legal name if possible. So that's things like, it matches what's on their driver's license or their social security card, things like that. You definitely do not want to put nicknames, shortened versions of their names, anything like that. You want it to be their legal name. And then you can use their preferred name here for what they want to be called when you're checking them in or, when you go into the room, things like that. and I'm not sure on the clinical side where that shows up, but I imagine, I imagine it's visible when the patient's checking in. I wouldn't think that it would just show the legal name. So the alternate name. So like they said, Blue Cross, Champ VA, and
Medicare.
Medicare. Thank you. Those three, the name has to match. The only thing that can be different is like the middle initial not being there or something like that, or the middle initial being added. And even that is sometimes an issue with Medicare and Champ VA, not so much with Blue Cross, but everything else is. So on the account side, this is where you're going to change that information. So down here, and I would put it in both unless you actually have a different uh, person as the primary insured. So other than that, I would actually use this and put their information into both fields. And so with this one, the only issue that you have there are with juniors and things like that, where they have a suffix with their name. And, uh, you know, those it's kind of difficult to get them to go through regardless of how you enter it sometimes, if you're using the alternate name field anyway. But if you are going to enter it, make it part of the last name and just put a space, no comma, anything like that. So just the last name, a space, and then junior, senior, whatever it happens to be. So when you update this, if this is something that you're actually updating for a biller, you have to let them know that you've updated it. Don't just let them know that you've updated the insurance, because there's something special that we have to do to get that to pull in into the claim after a claim is created. It won't just automatically update like some of the other insurances do. So, normally we can just pull an insurance in, everything updates just like it is on the account. With this field, it just does not update for some reason. It's a glitch in the system, but it will not update, and we have to actually delete it off of the claim and pull it in completely new. So, but anyway, and but you're really not going to have to use that for anyone or any payers rather, other than Blue Cross, Champ VA, and Medicare. And then and then Medicare, which we actually showed you that one. And this one isn't a Medicare patient, but I'm just going to show you. So when you're in here and you're looking for the Medicare secondary payer, you click on the additional info, and then here is where the additional payer information is going to be. Normally, with it being Medicare, it's going to be MB here, and you're going to change it to either 12 or 43 normally. Okay. So that was all the examples I have.
I have a
Do you guys have any
question.
questions?
When do, like in the front end of the question is, when do we put in a different name for the insured versus the patient? And as an example would be like the Blue Cross Blue Shield. For example, I'm on my husband's policy, so I have the same number as him, but with a different 2-digit prefix.
Mhm.
So I don't put him in as the insured because I have my own number and my name is on the card.
Blue
But
Cross is, yeah, I get it. So Blue Cross is really lenient also. So even
mhm,
if you didn't have your own suffix at the end, Blue Cross is one of those plans where you could pretty much put the patient in, and most insurances are actually that way. Most of them, you could actually put the patient in as the primary insured, and it will go through all day
okay,
long. Okay, most of the time. But if you know that the primary insured is someone else, it's better to go ahead and enter it the way that it shows on the card. So if it shows that someone else is the primary insured, it's better to go ahead and get that information from them right then while you have them checking in, rather than having to fix it later and try to contact the patient and things like that. Because if you have to fix it, you know, it's not only a headache trying to contact the patient, but you also have to consider how long that claim has already been on hold, because, you figure there's a few days before it even gets to the insurance company. Then the insurance company takes it, and how long is it going to be before they either reject it, and if they don't reject it within a few days, say, 10 or so days, then they're actually going to hold it for processing and then deny it at the end. And then they can hold it for 30 to 45 days. So your turnaround time for those claims just becomes a really long period of time when all you had to do is just get the information to begin with. Does that make sense?
Yep.
Okay. But yes, you are right. Most of the time it will go through without it. And we do send them through. That's not something that we usually send back unless it's just needed or unless it shows up as an error. And sometimes they will show up as errors in the system and won't let it go through without correcting it. But that's only for certain payers that it does that.
Right,
Right.
Shelley, because I've seen where Blue Cross, when they put the uh, card holder's name in, and the patient is not the card holder, where Blue Cross has denied for birth date not matching because they're not looking for the card holder, they're looking for the patient.
Right.
And
That's
so
right.
that's why they have the identifiers, the O2s, the O1s, 50s, 00s. That's why a lot of insurance companies went with the patient identifiers. That's why it's
That
important to have them.
Yeah, that you usually get those rejections because we have the wrong suffix. It's not really that the wrong primary insured is listed. It's because we have the wrong suffix on the ID number that we submitted on the claim. So we'll have, say, the primary insured's ID number listed, their suffix. So say 00 or 01, whatever it happens to be. But our patient suffix is actually like 02 or 03.
O2,
So
right.
when we submit those through, it'll come back and it'll say that the date of birth doesn't match. And it's not really that the primary insured is wrong, because all you do is fix the ID number and those will go through, even if the primary insured is the actual primary insured rather than the patient. I wanted to show you guys something on this one. So I'm back on one of the Medicare eligibility checks. If you click on coinsurance on these, it'll also show you if your patient is QMB. So if you have any question about if it's a Medicare QMB, not Medicaid, but Medicare QMB, it'll show up right here. And that also, if the Medicare eligibility check is showing QMB here, more than likely that patient also has Medicaid. So you should be looking for a Medicaid card from them as well.
And I'd like to add to that too, Shelly, that if that is the case, if you don't accept Medicaid, you still cannot collect from the patient. That's what that QMB stands for. It's basically telling you cannot collect from the patient.
Yeah, they're not responsible for anything after the Medicare payment, basically.
Right, and if they are a QMB, even though you don't accept it, you didn't take the card, Medicare is going to automatically cross it over.
Yeah.
Yeah, they will. And then
And you may
Medicaid
get paid.
denies it. But,
Yeah,
well,
you'll
no,
either get
Medicaid will
denial.
deny it. Yeah.
We've had some that has gotten paid.
Wow.
Yeah. But I think it's very rare. Again, it depends on how much they allowed from the primary, but it has happened. Maybe toward the deductible or a large copay.
But if you see on your Medicaid eligibility check, which you're not going to see that on, in ECW, it's not going to say QMB on your Medicaid eligibility check, but you will see that if you check NCTrack. So, like I said earlier, if the Medicaid eligibility check does not have a plan code listed, and you go to NCTracks just to check further, and you see QMB in NCTracks, that usually means that the patient has a plan, a Medicaid plan, that only covers their Part B, or sorry, Medicare Part B premium. So they actually have no medical coverage for their Medicaid. And in that case, you can bill the patient. But again, you want to check even for those, you want to check to make sure that they're not Medicare QMB also. They shouldn't be, because the Medicare QMB automatically qualifies them for Medicaid. So you shouldn't see it on both. That usually indicates that they have a problem in their plans somewhere. But they are different.
Hi guys. Yeah, actually, this has actually been incredibly informative to me as I'm listening. I know Shelli, you had mentioned when data transfers from one EMR to the next. Just kind of a sidebar. We get a giant list of payers, and it says Humana with a PO box. Where do you want to put that? And I'm looking in ECW, Humana Commercial, Humana Medicare, Humana Medicare Supplement. They all have the same PO box. So we have been mapping those, and I'm so glad I'm on this call. And I believe, Melinda, you mentioned that, that 95% of these are probably Humana Medicare.
Mm-hmm.
So moving forward, and Lisa and Hannah, I hope you're listening, as divisions go on, it would make more sense for us to just map it to the Humana Medicare. That should help from the billing side. We wouldn't know, when we see it, we don't get a list of patient names. We just say 7,000 patients have Humana with this PO box. 300 have Humana with this exactly the same PO box. So this has actually been very beneficial for us as we move forward to make sure that we're mapping. Obviously, we should be mapping the larger amount to Humana Medicare, the smaller amount to commercial, and it should hopefully, eliminate people having to update those profiles. Again, always check. You should always check that card, check for those plan codes. But we are definitely going to make sure that we're mapping correctly too, so a majority of this is handled when that data gets transferred.
Awesome. Thank you.
Okay.
So something else with the cards, and you were talking about addresses, which made me think about it. So when you guys are looking at the ID cards and you're trying to determine which payer profile to select, so which insurance to select in the system, you're wanting to go with the one that matches all of the information that you have. So with that being said, you're looking at the address that it shows on the back of the card to send the claim to, along with the payer ID. But once you find that, you don't want to just select whatever you find. You still want to make sure that the name of that insurance matches at least close with what's on the card. So, for example, don't let it match the address and the payer ID, but say the payer name says Connecticut State Health Employees, but on the front of your ID card it says, AT&T benefit plan or something like that. You don't want to, even though the address and the payer ID match, you still don't want to select one that's that different. Now, if it's just, say, United Healthcare, Medicare Advantage, or something like that, one of the generic plans, then yeah, it'd be safe to select one of those, but not, not something that's that different. And if it is different, then that'd be one that you would send to Melinda to have added to the system, or at least have her look at it to, confirm that it needs to be added. And if it doesn't, she'd send it back to you and tell you use this one instead.
Yes,
And then,
thank you, Shelly.
so one more thing. So when you're adding an insurance, you actually can choose different things to run your eligibility check, or sorry, to
Sir,
search by your search parameters. And all you have to do is click this little button here and then change this. So it defaults to name until you change it. And you can select by all of these different things. So payer ID and the name are usually, the easiest. And then of course address is going to be next, but you can select by any of those. And all you do is you just I don't know any of the payer IDs off the top of my head. All right,
I was
so
going to ask,
select address.
can you bring up Blue Cross, for example, Shelly?
Yeah, because that's the only one whose address I know off the top of my head. So, all right, so PO Box
Yes.
35 is Blue Cross, and so it'll pull up any that have that same address, and then you just go through the list and select which one is is the best.
Yeah. And I just want to elaborate on that while you got the Blue Cross pulled up. We did that with the prefixes and everything that you see because the way it was set up in CareCloud, we wasn't able to run reports on just certain types of plans of insurance. And so in ECW, they said, well, they made us enter them in that way. So that's why you see like a lot of the payers marked by certain prefixes, because now they're able to run a report on how many of those patients that they have seen. So if they're calculating how many of these patients they've seen on this plan, in case the providers decide, well, we don't want to see this plan anymore, or how many how many patients do we have on this plan to see if it's worth our time, then they're able to find these patients a little easier. So that is the reason for the different profiles, maybe with the same addresses, because it's for reporting purposes. All right. Any other
All right.
questions?
Yeah, this is Jennifer. And Shelly, do you see the magnifying glass just for, additional reference? That magnifying glass will also maybe put it up in a little bit of a bigger box, right? This will allow you to search also by name, PO box. You can hit that name with the drop down, and the only reason I mention it is it makes it in a larger box where you do not have to scroll through 6 at a time. So if you're familiar with BCBS, but also don't eliminate blue, right? Because you can put in blue.
That's right. We do
and get additional options, right? So there are, of course, with ECW, there's always a ton of ways to do things. And it's based on your preference. If you want to, go on that outer field where Shelly was previously, or you can hit the magnifying glass, and this will give you like 5 or 6 more options before you have to start to scroll.
Yeah. And this, when you scroll down here, you click the little arrows to go across.
And just to add, you see those ZZs? You will never pick on those. That's the ZZs is in order for us to be able for if there's DME that needs to split from the claim to go with a different place of service. That's what those are for. Those are for billers. it corresponds with the actual primary payer, and it automatically splits whenever they do a claim with a place of service 11 and 12. So you won't ever have to worry about those ZZs.
Now,
Yeah,
that's
the
why it's
only
important
thing,
that I was going to say that's why it's important that the correct primary payer is chosen. The system automatically knows to split to a ZZ, and it defaults to place of service 12. And that's why that's set up. It's mapped to do that automatically if the correct insurance profile is picked.
yeah, if you select
Yeah.
Medicare or Medicare Advantage, it will automatically place one of these ZZs in when it splits the claim, and it will move your DME to a separate claim from your other charges. Because for Medicare and Medicare Advantage, those have to go separately.
Yeah. All right. What other questions do we have? Okay. Well, if you end up having questions afterwards, feel free to email Melinda and Shelli. They have more knowledge in ECW than I do. I know bits and pieces, but I consider Shelli our guru. So Melinda is on her way of being a guru as well. So definitely email these ladies if you have questions or any concerns. And then, of course, Jennifer, if we need to get the ECW team involved, they can. But if you don't have any other questions, we will go ahead and end for tonight. And we appreciate y'all joining in for the presentation.
Thank you so much to the three of you. Appreciate it very much. Have a good night, y'all.